Jim McKenna to my support. Never expected that, Jim, did you?
I didn't hear what it was, Malcolm, but the answer's probably not. Okay, extra chairs. This is more than was here 5 years ago.
The chess is in a lot more trouble than it was 5 years ago.
Last time.
Oh, did it? Okay. It's so memorable.
Ready to go? Are we sitting when we answer? Are we happy to sit?
I'm easy, whichever way.
Are we happy to sit when we answer questions? Yes.
Are we going to sit while we're answering questions? Jim wants to know. It's all right by me. Yeah. See what the audience thinks, I suppose.
Okay, ladies and gentlemen, good evening, and thank you for coming to the 5-yearly HealthWatch Health Hustings. For those that don't know me, my name's Jim McKenna. I just want to go through one or two process things first of all. The most important probably being the evacuation procedure in the event of. Emergency exit that way and emergency exits behind. I don't know if there's a fire alarm or not, but there are certainly no fire alarms planned, so if you do hear an alarm, then form an orderly queue behind Graham Weston. It will probably be quicker than he looks if it comes to an emergency. In terms of format this evening, can you hear me in the back? In terms of format this evening, you're probably aware there are 3 pre-prepared questions which each candidate will get a chance to answer. We've drawn lots, so we have an order of a running order, as it were, for the first question, and then 1 becomes 2, 2 becomes 3, and so forth for the 3 questions. The intention is to finish around about 8 o'clock in terms of answering those questions. Is that good timing for your exit, or are you going to get up anyway?
We're going to get it.
Sure, quarter to, okay. Maybe we'll have just done the second one by then, okay? So the intention is to finish the round of prepared questions by around about 8 o'clock, at which point we'll have a couple of minute break. The doors will be locked, so don't try and escape. And then there will be a public question session. Now, all of you should have been given a piece of paper. If you have a desire to have a question asked or to ask a question, then please write whatever you want to write and give it to somebody from HealthWatch. Somebody from HealthWatch is going to wave at me, are they? One at the back, one there. Mind you, he's a bit biased. He might 2 there. Okay. If anybody has any questions, just pass them to the end of the row, and somebody will come and pick them up. Okay? We're here till around about 9 o'clock. What I'll say to candidates, and it'll probably be more difficult for candidates and Malcolm Lawrence, who's just arrived. Malcolm, good evening. It's understandable at his age. Malcolm, if you're asked to speak, please make it succinct and don't talk about your service during the war, okay? Excellent. But this applies to both candidates and members of the public. We get...
Keep your answers short and sharp so they don't have a problem with any report there.
Agree. So this applies to everybody really. If you can keep things succinct, we get more done, more questions asked, and more opportunity for the candidates to answer. On that note, I think the plan is each of the candidates, starting with Tim on the far side, concluding in no particular order with Derek on that side, will just say who they are, what party they represent for those people that haven't met them before, and then I'll read out the first question and Tim will have an opportunity to answer it because he drew number 1 in the lot. Okay? Does anybody have any questions about process or procedure? Is everybody in the meeting they expected to be in? Excellent. In which case, take it away, Tim.
Okay. Yep. So good evening, I'm Tim Andrews and I'm the Green Party candidate.
Good evening, I'm Graham Claderwood, the candidate for the United Kingdom Independence Party, UKIP.
Good evening, my name is Andrew George. I'm the Liberal Democrat candidate.
I'm Cornelius Olivier, the Labour Party candidate.
Good evening, I'm Rob Simmons, I'm the candidate for Megan Kerner, the Party of Cornwall.
And good evening, I'm Derek Thomas, the Conservative Party candidate.
Thank you one and all. Before I read out the first question, I should say, I've been asked to say by HealthWatch, these proceedings are being recorded, the intention being to produce a report on the basis of what's said and the questions and so forth are answered. So is everybody comfortable that if they do make a contribution or if they ask a question, that will be recorded as part of this process? In which case, thank you. The candidates can either stand or sit, it's entirely up to them, but we'll launch into the questions. Now, question number 1, What is your opinion on outsourcing NHS services to the private sector, and what position does your party take on it? Tim.
Okay. Thank you very much. My personal opinion on outsourcing to the private sector is that I'm against it, and I'm pleased to say that my opinion is in line with that of my party, the Green Party. I'm against it really because I don't think that the profit motive has any place in the provision of healthcare services. I think the sort of central driver for the NHS should be about patient care. That should be top priority rather than businesses seeking to make a profit out of that. I think there are other reasons why outsourcing should be opposed. I think it leads to the fragmentation of services, and it leads to a sort of contractual inertia whereby services can be contracted out for a set period and then it's very difficult to alter them, which I think is going to be really necessary over the next few years because the NHS is facing a lot of challenges and needs to change, evolve and adapt. Outsourcing can lead to the cherry picking of services by the private sector looking to get the most profitable ones. It leads to an increase in administration costs as well. It already has led to an increase in administration costs for the NHS. Those are the reasons why I'm against it. The Green Party has a vision of a publicly funded, publicly provided NHS that's free at the point of use, and if elected I would be championing that vision. Thank you.
Tim, thank you. Second speaker is Derek.
Yeah, thank you. I spent a lot of time talking to people, and when I talk to patients, Tim's absolutely right. We have to put everything where the patient comes first. And when you talk to patients, actually, when they need healthcare of any shape or form, they're not actually that concerned about who provides it. What we should be concerned about is that they get the best care available. So my position is the NHS is an enormous organisation, the biggest organisation in the world in terms of delivering healthcare. And sometimes there are aspects of it that can be done differently. The one thing I'd probably disagree with Tim on is that many of the organisations that deliver healthcare services for the NHS are not profit-making organisations. They're not for profit, and they provide a service where actually they can involve the volunteer sector, which can provide a broader and sometimes give more time to help patients. But if we're going to have parts of health services going into other groups other than the NHS, then we need very strong leadership, very clear commissioning and very clear accountable structures so that when things are not delivering for patients, they can be quickly sorted out.
Derek, thank you. Graham?
Well, UKIP's against there being any more privatisation. Outsourcing is a quaint, nice word for privatisation. And that's provoked quite a synthetic argument between Labour and Conservative. You would forget, in listening to Labour, that they are the ones who started it. When they left office, some 4 or 5% of services were privatised. It's gone up about 1% under the coalition, so hardly a great increase. We wouldn't take things back with the upheaval that has, and most of them are things which can quite easily be checked. If it's cleaning, very easy for a manager to go around and make sure the company doing it has done it properly, and presumably the contractor's got the price right. The real issue is not that, but PFI, Private Finance Initiative. That's what's been harmful and is real privatisation, where private firms are building hospitals, building schools, and it costs a vast amount. Governments like it. The Conservative Party started it. Labour proliferated it. So Mrs Hodge, the chairman of the Public Accounts Committee, a Labour member, says they were seduced by it. And something in the National Health Service, 14 billion of cost, is going to cost the taxpayer 76 billion. They like it because it doesn't appear on the balance sheet. They can pretend it's not a debt. But that's the thing that must be stopped, and we shouldn't have any more of that.
Graham, thank you. Cornelius?
Well, my opinion on outsourcing NHS services to the private sector, better known as privatisation, it is being used at this time to break up the NHS. That this general election is make or break for the NHS, because the level of privatisation that's happening at the moment means that if there is a Conservative-led government or a Conservative Lib Dem coalition after the next election, there will be no NHS in the form in which we know it in 5 or 10 years' time. That is what is happening. Now, I would never say that there should be an absolute iron curtain between the NHS and the private sector, but what you have to always have is that the NHS sets the agenda of what happens, and that the private sector, if it is involved in working with NHS institutions, conforms to a patient-centred agenda. One of the things that really concerns me in the current situation is the way in which some GPs and some consultants are beginning to think of themselves less as public servants and more as healthcare entrepreneurs. I think this is a creeping tendency which is affecting the psychology of people who are paid by the NHS. It's not about quality of care, the privatisation agenda that's happening at the moment. It's about driving down costs as far as they will go. And we have examples that are happening locally. Most people here who are interested in health will be aware of what has happened at West Cornwall Hospital, where the cleaning staff have been transferred to a private company who are not even capable of paying their wages properly. How can a company that can't even manage a payroll be responsible for hospital hygiene? So, you know, what is happening is the breakup of the NHS when we talk about outsourcing, and it has to stop.
Cornelius, thank you. Andrew?
Well, patients must always come before profit in the NHS. I opposed the Labour privatisation of out-of-hours GP services to Serco, and I reported them when they were falsifying figures in terms of their response times. And the problem is, as the new chair of the clinical commissioning group, Dr. Colin Phillip, said to me and certainly others when he took on his role last year, is that the problem is that if you have a lot of different providers simply working to contract, no one is necessarily doing what the NHS used to do, which is doing what is necessary ultimately for patient care. The patient will always fall between the cracks in the contracts, and of course the companies themselves will only work to that contract, and they are very good at writing those contracts so that they're easier to work to, as we found with Serco, and they've recently handed the keys back, as it were, to the NHS, and hopefully will in turn get a better service going forward. Labour also, of course, outsourced, and this was enforced some 9 years ago, 15% of all elective surgical work to the private sector, operations which were paid for but not necessarily completed. So, I mean, if you want to look at rolling out the red carpet to the private sector, you need to go back beyond the period of the coalition government. And Graham's absolutely right that PFI is simply a system by which future generations pay for the profligacy of us now by simply asking future generations to meet the bill of the costs of putting the capital investments in. I opposed the coalition government's health and social care bill, then Act, and I would say that as a result of the campaigning which I and indeed others were engaged in, we did cause a pause. We did make the bill less bad. We did take out some of the more extreme levels of privatisation which the Tories were particularly keen to have in the bill. But even after making it less bad, I still opposed the bill because of the way in which I felt that this was running the risk of creating a health service which would put private profit before patient care. Cornelius is absolutely right about Mighty. They're not competent to treat their workers well. It should never have been outsourced. I opposed it at the time, and also I have protested to the Royal Cornwall Hospitals Trust and been to see the Chief Executive following the public meeting which I held with Dr. Peter Carter when he came down 2 months ago about the outsourcing of pathology services at the Royal Cornwall Hospitals Trust. We looked into that issue. They have rowed back on that, and they will look again. And there is a big risk, a big risk, if we're simply salami slicing every single aspect of the NHS and it has to wash its face as a business unit. The the future of the NHS is at great risk. Right now, the private sector is camped out on the front lawn of the Royal Cornwall Hospitals Trust there at Trelisk, cherry-picking all of the easy and most profitable work, and that is as a result of privatisations both of the past and what is going on at present, and we must put a stop to it. And we must also put a stop to the way in which actually these are private contractors, consultants and GPs. I mean, people say it hasn't been privatised already, they actually have private contracts. That actually we need to look again at the consultant contract, because I don't think it's right that we have consultants that can simply work in both camps. They need to decide which side of the fence they're on. Either they're with us on the NHS or they're in the private sector. They can't be in both camps at once.
Andrew, thank you. Thank you. Rob?
My position and the position of Mebby and Kerno is very clear. We want a health service that's free of point of use and that's in public hands and that's controlled by public hands. We want to see an end to privatisation. We want a rollback of privatisation. Do you know, everyone on the panel here has cited examples of Serco and Mighty and all of these different companies that perform very bad services, and the reason that they can squeeze a profit out of health services is by doing them badly. I recently had an email conversation with a doctor at Trelisk, and he was very concerned that, you know, that all of the kind of norovirus and all of these kind of infections that we've had in the hospitals, and he was making the example that it was linked to when cleaning was commissioned out of public hands and into profit makers. So my position is clear, and I think we really need to be very careful when we're coming up with things like the Trade Transatlantic Investment Partnership, TTIP, and I think that's just going to make things worse. And we need a real change in the way that we look at public services, because for too long we've had this very neoliberal consensus that corporations need more power and they should have more control. And what actually we need is the people need more control of public services, not the corporations. So my position is very clear: no to privatisation, and we should roll it all back. Thank you.
Rob, thank you. We have probably 5 minutes for questions from the audience in relation to what's been said. If you want to address a question to a particular candidate, that's fine. But if you are a member of a political party, can you give that in addition to your name when asking the question, please? I've got Ruth.
I am a member of a political party. I'm a member of the Liberal Democrats. And what I'd like to ask is of Derek, who suggested that people don't really mind who provides their care as long as somebody does. And he also went on to say that not everybody would be providing outside of the NHS system would be for profit, but there would be voluntary. And that set my mind wondering how voluntary is voluntary. I mean, it's not just about taking around cups of tea on a trolley, is it? I want to know exactly how far he thinks volunteers should provide a national health service for the people of this country to replace the largest, as he said, one of the largest employers in the world, one of the largest organisations in the world. How does he think that's going to work? I mean, the last lot of voluntary...
Ruth, if I can ask you to stop there, I think the question is fairly clear, and we may need to get somebody else in as well. So thank you.
Fine, thank you.
Thank you.
Well, firstly, the voluntary sector are not all volunteers. So, and there's lots of organisations that are not-for-profit organisations that deliver really good services and care for people. When you've got the Pioneer Project in Penwith, which is doing a fantastic job. When you speak to GPs and when you speak to people in the nursing profession, and I've spoken to nurses today as I've been knocking on doors, they think it's a fantastic piece of work that is enabling them to do something that they couldn't do at the moment within the NHS. So that is a really good example of how it works well. But I said quite clearly at the beginning that there needs to be very good support and good accountability. We're not talking about replacing the NHS. I don't agree with any of the accusations that are made about the Tory party. David Cameron, for one, knows exactly what it is to rely completely on the NHS, and he's committed. We've actually committed, when we get to it, when we can sort the deficit out, £8 billion, which the NHS England are asking for. So there's no lack of commitment from us to keep the NHS delivering care free at the point of use. But we recognise that the demand is growing rapidly. It's a completely different service to what it was when it was set up. the medicine and the advance of medicine is getting more and more expensive and more specialised, and so we need to look differently at how we continue to meet demand. I mean, in Cornwall, demand, because of a growing older population, has gone up considerably since 2010, and we need to respond to that.
Derek, thank you. Next question from the lady with the glasses there.
So I'm going to follow that question up. Mr. Thomas, if Virgin bid for child psychiatry services in this county, as they already run them in Devon and they're up for tender, would you support that bid? That is a for-profit company. It will mean that I, as a consultant child psychiatrist, will see a child run by one service and find the mother is being served by another, the Cornwall Foundation Trust. And my work will fall apart and be fragmented. Do you or do you not support such a company, a for-profit company, running a large section of our already underfunded and desperately needed child psychiatry services? Thank you.
Thank you.
I'm not. I would much rather that the frontline services that we need to provide for people, so they get the care they need, and not just the medical care, but actually the support and the just the confidence that patients and families need, that they have a point of contact and they're properly cared for, properly supported. I would much rather that could stay within the NHS. But there's obviously good reasons. There must be reasons why some of these things are having to change. But I don't particularly think that for-profit organisations should come in and take services that can be delivered by people in Cornwall. I'd much prefer that we can train our local people, get the skills they need, and work with the NHS to deliver the service we need. Of course, that would be my preference.
Derek, thank you. In the interest of balance, if any of the candidates wishes to say something succinctly in relation to either of those two questions, you can do so now before we move on to the next pre-prepared question. Andrew indicated then Tim as well.
Okay. Yes, thank you. I mean, I think it's quite clear that in spite of the efforts by Derek, in answering actually the first question, the primary question, that the Conservatives are still quite happy on the basis of the choice agenda, that using that as the Trojan horse to enable the private sector to take over and run a vast array of NHS services, whether it be psychiatric services, whether it be psychological services, whether it be core NHS services of the types that we're talking about now. So there is indeed a real risk, and I think that we do need to be absolutely clear that there is a clear dividing line. I think Cornelius is right, although I have to say that Labour's record in this is not so good. But what we have is we have a clear dividing line between the Conservative Party that has made it quite clear, in the Health and Social Care Bill in its first iteration, that they are very committed to actually having a wide range of providers, and this clearly will include widening the range of private sector companies running healthcare services. It will result in fragmentation, and irrespective of the magic money tree, which it seems that the Conservatives have rolled out of their manifesto this week, saying that they can find £8 billion, they won't tell us where this £8 billion is going to come from, which has made themselves a complete laughing stock as far as actually core frontline NHS workers are concerned. They cannot see where this money is going to come from, but actually you have insincerity behind the response as well.
Thank you, Andrew. Tim?
Yeah, thank you. I think we need to understand what's driving this process of outsourcing and privatisation. It's a combination of two things. It's the introduction of marketisation of services and the purchaser-provider split that happened some time ago. And it's also driven by the need somehow to get costs down, because the budget is very tight for the NHS, and managers are trying to make the money go further. But I think there's a myth out there that somehow the private sector is always more efficient than the public sector. I think the private sector comes in with lower bids because it's usually employing people on poorer terms and conditions. They've got much worse pensions, and they're putting the quality of the service at risk. That's a generalisation, but quite often that is the case. I think what we need to do is restore the the self-confidence of the public sector, not just in health, but across the public services generally, because with a public service ethos that's putting the needs of ordinary people first, that has always got to be better than trying to find profit.
Tim, thank you. Cornelius?
Yeah, very briefly, as requested by the chair, privatisation...
Of everybody.
Of course, yeah. I know, right. Privatisation is the death of teamwork. Now, going back to the local example I quoted earlier of Mighty, what the nurses say who work in Cornwall's acute hospitals is we used to collaborate with our cleaning staff, we used to collaborate with our domestic staff, and now we can't because they have job descriptions that prevent them from doing so. Now, the NHS is founded on a teamwork ethic, and privatisation is destroying that. Also, Andrew's pointed to the clear dividing line on the Conservative attitude to the NHS and his attitude and my attitude. And I do think that Andrew is on the right side of the line about the NHS. But I would therefore say to you, surely, if you want the NHS to continue in the future, you have to commit yourself to not having anything to do with a Conservative government after the next election. You need to say that.
It's not going to happen, don't worry.
Graham?
Say it.
Well, listening to the question about Virgin, of course they shouldn't take over any clinical organisation. It's all, I'm afraid, ideological. That's the only reason this is been done by the coalition. Even probation service, which I come into contact with as a lawyer, been privatised. So you're paid by results as a probation service, and it's absurd.
Graham, thank you. We have time for just one more question. That will be the gentleman at the back who was first with the check shirt on. If you wait for the microphone, sir. Thank you. There will be a chance, obviously, for hours of questions later.
As your instructions, I have to say that for the very first time in my life, I've joined a political party, and that political party happens to be UKIP. And what I'd say to the panel is, surely you can fight profit-making in the NHS locally, and you can fight profit-making in the NHS nationally. But you should follow the hierarchy of decision-making, and that comes up to UKIP, which comes up to EU, where there is a lot of large lobbying going on for a direction and strategy throughout Europe, and you can see this happening in other countries where privatisation becomes a major issue.
So is the question there, do the panel agree with your assertion?
Well, yes,
okay.
Yeah, discuss that point.
Okay, thank you. Who wants to be first? Graham.
Well, yes, I agree. I mean, there are worrying things happening. There's a secret trade deal being negotiated by the EU, which may affect the national health considerably. I don't like things being done in secret, and something needs to be done to stop it. But the danger of that is that our NHS will have to be privatised in part, and then if we change it, or any future government changes it, they can be sued by American companies who bidded for and got the contracts. So I hope that will be stopped. And Europe, I'm afraid, dictates so much of our lives and is behind the scenes of any agenda, and it ought to be stopped. We want, of course, there to be a referendum to come out of Europe, so it can stop.
Thank you. Rob, you were next.
Yeah, thank you for the question. It is a risk, and there is this growing trend in the EU that for more powers to corporations. But I don't think that's something we should be afraid of. I think we're going to have to fight for a public NHS, and unfortunately we're going to have to do that if that's Labour or the Tories in government. So I don't see that fight as any different to doing it against Europe. It's going to be a hard task, and we're going to have to work with other people across Europe. But I don't think because we're part of the EU that we have to have a fully privatised health system. No.
Okay, Cornelius and then Andrew.
Yeah, well, again, I'll be brief. I mean, Europe, in no way, shape or form was Europe responsible for the Health and Social Care Act. That was the Conservative Lib Dem coalition. So I think to blame Europe for privatisation in the NHS, when in fact all over Europe there are public health services of various kinds which people in those countries are very keen to defend, is ridiculous. What it makes me think of, when I was a lot younger and I started being politically active, the Soviet Union was still in exist. And I was forever meeting people who would tell me everything, CND, the Labour Party, the TUC, the African National Congress, were being run by the Kremlin, right? Then, when the Soviet Union disappeared, all those people started blaming Europe. That's what it seems to me. There's always got to be a conspiracy which is being orchestrated from somewhere else.
Andrew.
Well, I think that Cornelius has dealt with the conspiracy theory part of the argument, but there was an embedded question which was coming back to TTIP, the Transatlantic Trade and Investment Partnership issue, which certainly is being dealt with at a European level, and you're certainly correct about that. And there is I think growing concern and suspicion about what this is about. And my fundamental concern about this is that the advocates for TTIP haven't really explained to me nor anybody else what the problem is for which TTIP is the solution. Until they go about actually addressing this issue and we have a more open debate about it, really they are on a losing wicket as far as TTIP is concerned. I mean, certainly we need to be looking again at the whole relationship with in terms of competition and the running of health services. It's not just European competition law which actually if you like, bears down on the health service, because there is a lot of competition law within the UK itself, which actually is more significant when it comes to issues of addressing matters of anti-competitive behaviour and so on. I do think that there is a wider issue, the TTIP issue, which I think is if you like a shadow hanging over the NHS at the moment. There's a lot of concerns which have been raised as a result of it. It will come before Parliament later this year or early next year, and I think it's really very, very important that all of you, get involved in that debate, because it needs to be made more transparent. People need to fully understand the potential risks, and if people can really make the case for it, the opportunities that actually TTIP represents. Thank you.
Andrew, thank you. Tim?
Thank you. I want to make it clear at the start that I'm very much in favour of the European Union, but I do regard myself as a critical friend rather than an uncritical one. And I am very concerned about the level of corporate lobbying that goes on in Brussels. And some of you may know that last year we had a Green MEP elected in the southwest for the first time. And speaking to her earlier this year, it was quite horrific really hearing from her just to what extent there is lobbying by big business in the EU. I think that one of the problems with the EU is that it has embraced this neoliberal free market agenda, and it's continuing to pursue that, and there are elements of it that want to apply that ideology to the provision of services and not just the trade in goods. I think you look at things like actually how the whole Eurozone, the Maastricht criteria for that sets targets for the amount of debt that individual countries can take on. That's all about constraining the role of the state and allowing the private sector and corporations to come in and provide services instead. So I do think, while I don't think the EU is a key factor in whether we can unprivatise the NHS over the next 5 years, I do think we need constant vigilance.
Thank you, Tim. Derek?
Firstly, the actual privatised NHS, there is only just over 6% of the NHS services that are privatised at the moment. 5%, just under 5% were privatised before 2010, just to clarify that one. But in terms of the European Union, if you want sovereignty returned to the UK and you want us to make more of our own decisions, then there's only one party that can actually deliver a referendum and let you have your say.
Which way are you going to vote?
Right at the moment, I would definitely describe myself as a Eurosceptic, but at the moment, I don't think, unless we get a Conservative majority, we're not going to be able to really see what the European Union are willing to negotiate on. If we get a majority and we have a clear ability to deliver a referendum, I think we'll see good negotiation going on.
Derek, thank you. I accept you answered a provocative question from the gentleman on my left, but this is a health event, and I was strict. I'll be beaten when I leave if it moves into other areas. So we can concentrate on health.
Naughty Labour candidates.
Right. Question 2 then. How will your party provide seamless, appropriate and trustworthy elder care services to the people of this constituency and to the people of Cornwall? And the first one to answer this is Derek.
Okay. Well, I've been really clear about the important need to bring health and social care together in meaningful integration. I'm getting some good advice from people who have been very senior in the RCHT about the senior chief execs and others who are talking to me about how that can be delivered. I've talked earlier, people are getting older, and the other problem with I think, health services in Cornwall, and it's true elsewhere, but I'm concerned about down here in the Isle of Scilly, is that the vast majority of money goes to urgent care. A very tiny portion of health money for the NHS health services goes to primary care. And I think as more money comes to the NHS, there needs to be a redress of that, and we need to see a correction on that one. If I got elected, I have good reason to do everything I can to make sure that someone who's older, both my parents have recently been patients at West Cornwall, both have had quite serious operations in Trelitz, and so I've seen firsthand really good care, but also how actually there needs to be a smoother transition from being in hospital to being cared for and supported at home or in the community. Okay. So that is an absolute priority. I think that's the most urgent thing addressing us here in West Cornwall.
Derek, thank you. Great.
Well, Mr Cameron didn't really want to talk about the NHS as part of the 6 things he was allowed to by Mr Crosby from Australia. And down here we know why you don't want to talk about the NHS, Mr Cameron. We know about black alerts galore and beds being blocked and operations being cancelled. And it needs all to be tied up together so that aftercare is dealt with as an integrated service. Beds are blocked simply because people have got nowhere to go. And we saw from the Age UK telling us that there were some 900,000 people aged between 65 and 89 with unmet social care issues. We're not being told by the Conservatives where the cuts they're going to promise each year of 13 billion are coming from services. It would be nice to know that. They don't want to tell us because they know no one would vote for it if they knew it. Already in the last year, there were 40% cuts, which have been devastating. The total cuts, rather, have been 40% already. And yet Mr Cameron is trying to tell us all we want to do is save £1 in each 100. Very manageable, you'd think. But the reality is vast cuts have been made and are going to be made further. Otherwise, they'll be telling us where these will come from. It needs to be joined up. Can we really think that the National Health Service can bear any more cuts in the social services, which of course the local authorities have to provide? So they're given the blame, as it were, by the government. It needs to be changed. And we want some joined up cooperation and integration of these items. We want there to be, UKIP wants there to be some county boards, elected county boards, overseeing this, because at the moment one of our candidates is a doctor from Truro for the Truro and Falmouth seat. People it is not being planned properly. Cuts have been made in the National Health Service in the sense that when people are retiring, they aren't replaced. There's no thought about it. A friend of mine has known he's going to be retiring from a quite responsible position for a year. They haven't advertised his job, he's now left, and they're going to think about doing it. That's what we need to put right and get it all integrated so it's all in one.
Graham, thank you. Cornelius?
Well, perhaps the best person to answer the this question about how to provide seamless, appropriate and trustworthy elder care services would be the gentleman sitting next to me as the adult social care portfolio holder of Cornwall Council, but he can talk to us about it later. I think the obvious but not easy answer is that social care and NHS medical care need to stop being separate services. There has to be an integrated service. Now that sounds easy, but it won't be. It won't be easy to do that. But that is the future. As we have an ageing population, and also a part of the social change has meant that people have fewer children, and they are less likely to live near those children. There's a great deal more social isolation among people who are no longer mobile. So I'm totally with Andy Burnham, who will be Labour's health minister, on the creation of an adult health and social care service. That has to happen. There can't be this dividing line between local authorities and the National Health Service anymore. On the wider picture, we need far more prevention. What we are dealing with at the moment is people who keep coming in and out of hospital because they're receiving inadequate care at home or in residential homes. One of the great things about integrating social care and the NHS would be that standards in the care sector could be raised. I mean, one thing I'm very committed to as a Cornwall councillor is that when we next retender our adult care contracts, that one of the requirements of the contractors is that they pay the living wage. Social care has got to stop being a low-wage job. I mean, it will be it's going to be really, really tough, but that's what we have to do.
Cornelius, thank you. Andrew.
Thank you, Jim. And as a member of the Health Select Committee, we've undertaken a number of inquiries into this area, and indeed spoken to Jim, and Cornelius is absolutely right. Clearly, in a place like Cornwall, you need to consult quite widely to a number of agencies and a number of authorities in order to be able to get a full picture of what's going on and what needs to be done in order to bring things together. There was a major missed opportunity, I think, when the Conservatives forced through, if you like, against our protests, a change in the coalition agreement in the form of the Health and Social Care Bill, ultimately Act, because in the original proposal there was actually a route map towards the integration of health and social care. It's really good that there is apparently a cross-party consensus that health and social care should be better integrated. The best way of doing it, quite frankly, is to have a single budget. As long as you have two separate budgets, there will always be turf wars between health and social care. Whether that means democratising the health budget through Cornwall Council in this case, or quangoising adult social care budget through in this case the commissioning budget, is a matter which, quite frankly, is of secondary importance. What's really very important is that those two things are brought together. There's a whole set, which we haven't got time for this evening, of things which need to be done in order to get the architecture right. But the other issue, which I think is absolutely essential, is that you need to look at the front line workers. I have for years been campaigning to make sure that those who are providing the front line care for us, doing jobs which, quite frankly, I guess the majority of people in this room would not be prepared to do, even for double the wages that, in fact, home care workers, for example, get, quite frankly, that we need to make sure that we value and reward those people so they're not treated as they are at present. Because if we're to have a seamless service, as Cornelius was alluding, what I propose is benchmark standards. For the past 3 years, been trying to push this through. We've got the Home Care Association are in agreement with this. That's all the agencies that actually make up that association. And that includes, yes, living wage, travel time paid for as part of the salaried time, travel money to cover if you can believe it, some are still not paid that. The pressure on the agencies are intolerable. The local authorities, I have a lot of sympathy for Jim and the budget he has to work with, and the fact that they have to go for the spot price that they have agreed. I mean, the fact is we need to be looking at 18 or in excess of that pounds per hour in order to provide the kind of care at home that is necessary. then the agencies will be available, then you can discharge from hospital, then you can make sure that the whole of the rest of the health service will actually work effectively, because at present it simply is not working, and it has to be built up. Some might say built up from the bottom. I would say the top, because these people are doing a fantastic job, and without them the whole of the health and social care system will collapse.
Andrew, thank you. Rob, there's nothing personal about the abandonment of the front row. They did pre-notice.
Are they going canvassing?
I think so. Rob.
My party, Mebby Kerno, obviously believes in a Cornish Assembly. We believe in bringing services back to Cornwall and bringing the decision making about those services back to Cornwall. And what we would like to see is a Cornish NHS, and we'd like to see that as an opportunity to integrate health and social care, as everyone's been saying here. And I'm also quite glad that everyone's kind of on the same page on this. It shouldn't be two different things, it should be all together. But we want all of the health services devolved to Cornwall, and we want them taken away from the commissioning groups and trusts and put under democratic control. One of the other things that we're fighting this election on, and this is a major part of our manifesto, is fair funding for Cornwall. I'm sure many of you have read this, and it says that over the last 7 years, Cornwall received £220 million less. And it's also the same for Cornwall Council at the moment, which has a huge impact on health and social care. So I think if we're going to have a first-class health service, we need to be demanding the proper funding from government to deliver a first-class health service.
Rob, thank you. Tim.
Yeah, well, I'm part of the pro-integration consensus, so I'm not going to repeat what other people have said about the benefits of integration. I want to make some wider points, really. I mean, obviously, as everyone says, we're living longer, and actually the increased life expectancy is a real, success for the National Health Service. But one of the problems is that our healthy life expectancy falls short of our actual life expectancy. That on average, people in England, 20% of their life is actually spent with some sort of long-term limiting condition, and that's the sort of underlying challenge we've got when we're looking particularly at providing elder care services. So it's really important that we have an emphasis on preventive health, on identifying what are the preventable illnesses and diseases that are causing those long-term limiting conditions. There's lots of evidence out there of how these particular conditions can be caught early and can be prevented with the right interventions, and we've really got to make that a priority in the coming years. I think it's very important as well that older people and their carers and their families are given more of a voice in the system as well, so that they can actually express what their concerns and their desires and their wishes for treatment are. I think that that's something that really needs to be strengthened in the system. I think as well, there's a big issue around inequalities of health, particularly in a place like Cornwall, where if you're in a poorer community, generally your health is much poorer than if you're in the wealthier parts. That needs to be part of this as well. And I would finally just re-emphasise the issue about funding, because in terms of local authority funding, yes, it's the grants from central government have been cut by 40% over the last 5 years, and the Chancellor's budget, the coalition government's budget, is going to continue on that course of further cuts, probably deeper cuts actually, over the course of the next Parliament. Now that's having a real impact on the services that organisations like Cornwall Council can provide in terms of adult social care. The Conservatives still want to go ahead with those cuts. The Lib Dems wouldn't do quite as much, but would still be cutting. I'm not quite sure, having read Labour's manifesto, what exactly their plan is. We are very committed to maintaining and restoring local authority funding because of the real importance of these services.
Tim, thank you. One thing that encourages me, assuming I survive as long as Mayor's portfolio holder, is that whichever party is elected, adult care funding is going to be increased. So that's clearly good news for the people of Cornwall. I'll give you a chance to ask a question in a second, madam. What I would say is I am under some time pressure in terms of getting this question finished, the next question done, and then giving Health Watchers Committee the chance to collate public questions. So if you could ask your question, and then we'll move on to the final of the set questions, if that's okay. If there's a specific individual you'd like to answer first, then please say so. Thank you.
Hi, I work as a community care worker looking after elderly people and people with disabilities. And one of the worst problems that we face is high staff turnover. People don't stay in the job very long. And that's because I think the hours are so long. People have to work from 7 o'clock in the morning until 10, 11 o'clock at night with a couple of hours break in between. And they have to, most of my colleagues have to do that many hours because the pay is so low. We don't even make minimum wage. Because, like Andrew was saying, we don't get travel time in between the clients. So we don't actually even make minimum wage for what we're doing. So we can't get people to stay in the job, and it really, really needs to change. And I'd just like to know how that's going to change down here, because the council have already cut the amount of money per head, per hour of care, and people are rushing around. They can't provide proper care because they don't have time to do it. So how... if your party gets into government, how will you force or how will you fund a local council to pay proper wages and to provide enough money for care?
Thank you. Thank you. Andrew, you indicated first.
Yes, thank you very much. You're absolutely right, of course. As I indicated earlier, there is currently a race to the bottom going on in the home care sector, and indeed across the whole sector, a race to the bottom. Unless you put a floor in, as you indicate, and indeed as Cornelius, to be fair, has indicated as well, unless you put a floor in with benchmark standards, which is what I've been calling for a number of years, which is, as I say, a living wage, travel time, travel money, which is agreed at a national rate, and also minimum visiting times as well. I mean, what in the discussions I've had with the Home Care Association, and indeed, rather than going to see, the bigwigs up at Trillisk, I've been out with home care workers as well and the agents, and seeing what they have to face on the ground. What I think is also clear is they need to have an effective logging in and logging out system. Often that is very frustrating. As well. So, as a result of the way in which home care workers are treated, it's no wonder that you have a mass turnover of staff. And the problem with a lot of elderly, particularly if they are suffering a form of dementia as well, is that not having continuity of care and the unreliability of knowing whether that same person, that familiar face, is going to come and see you and you feel reassured by that person coming. It's another person you've never met before. That is the most destabilizing system that you could possibly have. The way in which it clearly needs to happen is that if the budget is shared, it's then in the interest of the acute sector to make sure that the primary care and the home care services are running effectively. They will look across both sectors, and they will need to make sure that you have a seamless, but it can only be done through proper, and that does mean financial integration between the two sectors.
Andrew, thank you. Cornelius?
Yeah, what I would very much hope for, Alana, is that if with the integration of social care and NHS care, standards in the social care sector of employment, conditions of employment and training and expectations of quality of work will be raised up to NHS standards. I mean, that's not going to happen automatically. It's going to happen because people are trying to make it happen. And I don't want to wait around for that. I want Cornwall Council to take the initiative, as I said earlier. And when we re-tender our care contracts, impose these higher standards within those contracts. That it will be harder than I'm making it sound. But if anybody thinks that the future of the NHS or the future of medical care in this country should lie with the private sector, they should look at the care sector. Now, within the care sector, there are lots of good practitioners who are conscientious and trying to do a good job. There are lots of people who are in it for the money and getting away with as little as possible. And that is, I'm sorry to say that is the case. There's a very high variation within that sector. And that's what happens if you leave it to the market.
Thank you, Cornelius. Graham?
Well, I have great sympathy because my stepdaughter is a person who does care work. She's trying to do a podiatry course, but in the time she has available and the hours they get and the lack of travelling time is quite scandalous. It's really a problem, of course, for the local authority, but the government starved them of money, and that's why I think we've got to stop any further cuts. UKIP has its manifesto came out today. I've been earning half a crust as a duty solicitor, so I haven't had the chance to see it today. But we're going to have more nurses and GPs, and our finances have been audited by an independent organisation. We have the money that can be there, unlike the Conservative Party, who don't know where the 8 billion they now promise every year is coming from. They're the party, they used to think that they were the party with economic responsibility as our key thing. That seems to be quite the reverse now. We want to do away with things, cut foreign aid. We can't afford it. When we can't afford the basics in our own social services in this country, and we can't afford to properly equip and fund our armed forces, we can't be thinking of sending money abroad. We want to stop H2S, something which we just can't afford either. The Barnett formula, we've got some money that's available, and we can stop there being any further cuts, and let's hope something can be done to make people enforce the law and pay the minimum wage for all the hours these people do.
Graham, thank you. Derek.
I'll be really brief about the national picture. We are talking this panel, some of the panel, that as if we just haven't got a problem with the national debt or deficit. We had such an issue last election, worse than most of the other European countries that are now really in a terrible state, such as Greece. And so actually the coalition government has done a remarkable job to reduce the deficit. And you can't, however much you want to put money into services, you can't do it if you have this huge debt and interest to look after it. But if I go right back to home, I've actually had a wonderful opportunity in the last, as a candidate, if I don't get elected, I've lost nothing, because the people I've met have been incredible. And on Saturday, I met a lady who actually came out after me in the street, who's off sick at the moment as a care worker. And she talked to me through some of the challenges that she faces in that job. But what impressed me and what was such a moving experience was how committed she was to the job and to the people that she cared for. But she talked about travelling halfway up the county sometimes to cover other people. And so there was, and she was, again, as you said, leaving very early in the morning, getting home late at night. But the commitment to the job was amazing. Yesterday I was in Penzance, in the east of Penzance, and a young care worker, probably less than 20, called me across the street, and I didn't know what she did, but she was talking about what she did. But she said something that was really interesting that I think we need to address, was that she's given 15 minutes to do certain tasks that clearly will take longer than that, and then she'll be given more time to go somewhere else where it's just not needed. And when she feeds that back, nothing is, both of these people I spoke to, they say that's never taken into account. Their experience on the ground isn't taken seriously by managers. Okay. And so that's one thing I'd say. But the other thing is, I've just got to say one point. If we think that Cornwall Council is completely efficient, there's no waste whatsoever, then carry on blaming the government. But the reality is that there is still room to prioritise the money that's available to Cornwall Council, and we could put more money into adult social care, and I know that Jim is working hard to achieve that.
Thank you, Derek. This is about what the candidates think rather than what I think. I'll happily talk to you outside the meeting.
I don't know what you think. I don't
But 40% is a big hit to take, I think. Tim?
Yeah. Firstly, I'm committed, and the Green Party is committed to making the minimum wage a living wage. And we're also committed to decent terms and conditions for workers, and it just goes without saying that care workers are not being treated properly at the moment. I just want to make a point about the money, because Derek's made it, and Graham's saying we've got to cut other really, really important things because somehow we can't afford it. We have one of the wealthiest economies in the world, and it just doesn't feel like that because there is so much inequality. And the top 1%, the richest 1% in this country, own the same as the poorest 54%. That's how unequal we are. So there is wealth in this country, it's just that people at the top are not paying their fair share. So what we need to do is get fair taxation, raise more money in order to provide the things that we as a society need.
Okay, thank you everybody, and thank you Lana for the question. We have the final of the set questions now. Now we are just after 8 o'clock, so what I'm going to do is invite the candidates to answer this as succinctly as they can, and then we'll take a 2-minute break whilst the public questions are collated. So hopefully we'll be in a position to do that in 10 minutes or so. The question which has been set reads as follows. A recent report from the independent King's Fund charity criticised the coalition government's 2012 Health and Social Care Bill as a disaster and a distraction, making it less able to improve care for patients. What should happen after the election in May? Graham, you're the first to answer this.
Well, according to my crib sheet, it was said to be by this organisation, the charity, a disaster, a distraction and damaging as well. And that's right, and it's monstrous that it happened at all, because it wasn't in the Conservative manifesto and it wasn't in the Liberal Democrat manifesto. So how we came to have it, no one knows. It certainly wasn't the Conservatives who had to do it to get the Liberal Democrats' support. We had something which no one promised, no one said. And it's about time we had a government that honour the manifesto and do what they say. Nobody seems to know what it was about. You have cabinet ministers even now falling over each other to say, actually, we didn't understand it. But why on earth did they vote for it? The only people in the country who seem to understand it or want it seem to be Mr Cameron and Mr Lansley, who's not standing this time for re-election anyway. It's just that we need to tell the truth and do what we say. It all comes down to funding. I've explained what we want to do. We have want to put 3 billion a year into the national health and 1.2 billion into social services and integrate them. And we want then to have that money. We've got the money, unlike some of the other of my opponents and their parties, and hopefully things will then be different. But it should never happen again that, and this was so unnecessary and no one understood it or wanted it.
Graham, thank you. Cornelius.
Well, in one sense, the answer is very simple. The Health and Social Care Act should be repealed, and if Labour win the election, it will be repealed. So, yeah, that's it. We have a fundamental choice here, because the NHS is not just about efficiency of long-term outcomes and all the rest of it. It's a moral issue. We've taken great pride in this country for generations that the size of your wallet makes no difference to the quality of healthcare that you receive, that it's about what your need is, what your income is. People have taken that for granted for a few generations now, and we are in danger of losing that. It is make or break this time. Now, the Health and Social Care Act only got through, I exempt Andrew from this obviously, because 51 out of 57 Lib Dem MPs voted for it. I'd like to think it was a mistake, but I don't think all of them were particularly keen on the NHS in the first place, because they're rather more right-wing than Andrew. But yes, repeal the Health and Social Care Act. You have to find money for frontline staff, so I'm very happy that Labour are going to introduce a levy on tobacco companies, who we can say are responsible for many of the health problems in this country, and a mansion tax, a tax that's very hard to evade. A house worth more than £2 million will pay a special levy that will go towards funding frontline staff. So we've got two specific practical measures which will be implemented as soon as possible after May. Thank you very much.
Thank you. Andrew?
Well, as you've just heard, and as I've mentioned before, of course, I campaigned against, very, very strongly, I have to say, very vociferously against their Health and Social Care Bill, and voted against the bill as well for a range of reasons we won't have time in the answer to this question to go through, but certainly the disruptive effect and all of the reasons which the King's Fund described were absolutely right. Yes, it was a completely unnecessary, yet again another unnecessary top-down re-disorganisation, I think, as someone once described it. It was however, what we don't want to do is to do that process purely for the sake of it, purely for the sake of political dogma. I've been working with others to try and find a new architecture for the NHS, one which is not as disruptive as the Health and Social Care Act was. And so I've been working with Professor Alison Pollock and Peter Roderick, and indeed Caroline Lucas and I co-sponsored the NHS Reinstatement Bill, which was introduced as a presentation bill to Parliament just before it rose, as an indicator to put down a marker, really. And indeed, it's gathered some cross-party support, except, of course, from the Conservatives. So there is a gathering momentum of, if you like, people that want to see a new architecture which actually does genuinely put the patient first and private profit right out of the spectrum altogether. And that is, I think, really important. Also, I've been working with Clive Efford, who had a private member's bill talked out by the Conservatives, of course, because it would have actually put right some of the major wrongs of the Health and Social Care Act. And Clive Efford, I should say, is a Labour MP, and it had some cross-party support. I was certainly a supporter. I supported him in the Bill Committee as we watched for hours on end as the Conservatives just tried to fill time in order to talk out actually another very good bill in the same way as my Affordable Homes Bill was talked out. The problem, just last one point, is that when this came in, and Graham's absolutely right, it wasn't in either manifesto, but it was actually in Lansley's mind. This is the problem. I'm not qualified, if you like, to do this, but when I met him shortly after the general election, where he's given his position as Secretary of State for Health, I did diagnose mild megalomania in that man, and I'm afraid that often happens to people who are given the instruments of power, that then they start pulling levers and they realise that people actually respond to this, and that sense of megalomania, that sense of, well, here's my chance to make a name for myself, and he came in with this totally damaging, destructive act. There's still lots to be put right.
Thank you, Andrew. Rob?
I think, do you know, this is two of the worst things about politics is here in the Health and Social Care Bill. Firstly, Cameron said he wouldn't do a top-down reorganisation of the NHS because he knew people didn't want a top-down reorganisation of the NHS, and what did he do? He did it. The second thing is it's that awful habit that politicians have of sitting in a room together and just concocting some idea that they think will work, that they haven't spoken to anybody else about, that doesn't work. What we need is an end to the Health and Social Care Bill. The NHS needs to be redesigned so that patient care is put first, but also it needs to be the complete opposite. It needs to be bottom up. There needs to be public accountability. There's not enough at the moment. And also, doctors and nurses need to be listened to, and they're not. It's the accountants and the bureaucrats that run everything, and they're looking at numbers in columns, and what they need to do is listen to the people on the ground about what is actually needed. Thank you.
Thank you, Rob. Tim?
Thank you. Yeah, I think firstly, I wasn't particularly surprised that there was a top-down reorganisation that took place in the coalition government, because I think Andrew Lansley had made it clear in the run-up to the election that he was minded to do what he actually did. And I thought 5 years ago, Derek, you even suggested that was going to happen as well, but I might have just been imagining that. Yeah, of course, the Health and Social Care Bill needs to be repealed. I think particularly because what we need to do is restore that obligation on the Secretary of State to provide a comprehensive healthcare service right across the country. You know, that is the cornerstone of the NHS, and it's got to be restored as a very clear statement. I think that we also need to just remove the marketisation from the system and get rid of the purchaser-provider split, which is just so inefficient and has added so many costs, admin costs in the system. I think we should be, you know, really getting behind the Simon Stevens report, the 5-year forward view that sets out the vision and plan for the NHS over the next 5 years. It will involve organisational change, but you know, hopefully that can be from the bottom up and cooperatively managed rather than imposed from the top. But there are some really interesting proposals for changes in the way that health services can be provided and joined together in different ways that I think we should be supporting. And I just come back to the point that I made in answer to another question. I think what we've really got to be addressing as first priority is tackling preventable illnesses. You know, the Derek Wanless report in 2002, I think, you know, said unless we tackle preventable illnesses, we're going to end up with a huge amount of demand on National Health Service, and that's where we've ended up now. So that's got to be our top priority.
Thank you. Tim, thank you again. Derek?
Yeah. The question was firstly about the Independent King's Fund charities' criticism of the coalition government's bill, and then what should happen after the election. It's worth having a look at the King's Fund website, because they've actually said some very positive things as well about what's happened in the last 5 years, and some very positive things about what the Conservative Party are projecting for next time. They commend the fact that we're recommending only incremental change to the NHS and just improvements in terms of how public services are delivered. But we fully support and will fund the NHS England forward review that came out in October last year. But in terms of what we do down here, I would be completely happy to support a single budget between health and social care. I think that'd be excellent. I'm interested with Rob because we talked about not breaking up the NHS, and then Rob said about having an NHS Cornwall, so I don't know how that doesn't break up the NHS, but certainly bringing the health and social care together, and we're giving the north of England the opportunity to work that out, and I'd like to see the same for this part of the world. But I think the one thing that challenges us in Cornwall, and which I would really love to be getting involved in and doing what I can, despite what some view of our approach to NHS in this room is tackling poor morale amongst NHS staff. They do a cracking job, they're skilled people, we need to keep them in the NHS and helping us to shape the future of the NHS.
So
but also addressing...
Why don't you give Derek a chance to answer, please?
But also addressing the issues we have about recruiting people to work in Cornwall and Ellerslie within our NHS and within adult social care.
Derek, thank you. Okay, well now it's 8:15. We have a couple of minutes break for candidates to stretch their legs, for HealthWatch to get questions together. Please stay if you can, but if you're not able to, thank you for coming. But we'll be back here in 2 or 3 minutes.